Hi, I'm Dr. Malpani. I'm an IVF specialist and I've been practicing IVF now for over 30 years. And one of the things which breaks my heart is the number of IVF clinics which have sprouted up in this country which have no sense of what IVF means. Because it seems that every gynecologist now wants to offer IVF, but because they don't have the required expertise, they take a lot of shortcuts. And unfortunately, patients aren't sophisticated enough to understand that shortcuts are being taken and effectively they're being used as guinea pigs. Because the doctor is more interested in making money rather than in helping the couple to get pregnant. Let me describe some of these games which some of these clinics play. So for example, a lot of these doctors don't have any IVF expertise at all. Sure, they're gynecologists, they've been doing a lot of gynecology for many years, but remember one thing, there is no actual exposure to IVF treatment in any of these medical colleges today, as a result of which the gynecologist understands the theory very well, but he's never actually monitored an IVF cycle ever during his training, which I think is shameful and tragic, but that's what the reality is. Now the doctor understands this big gap in his practical knowledge. So what does the doctor do? He does a course. How does he do the course? He usually goes abroad perhaps for a week, or he finds an IVF clinic which does a diploma for 1 week so that he can get a certificate or get a diploma and put it on his wall and say, hey, I did this certificate course and now I can do IVF. Big difference between having done IVF for 30 years as compared to doing IVF watching. I shouldn't even say doing, because remember, all these diplomas and certificate courses or going abroad will only allow the doctor to observe what's happening in an IVF cycle. The doctor isn't actually allowed to do the IVF, and if a doctor has never done IVF on someone else and starts practicing on you, the results aren't likely to be very good. If you want to be a guinea pig, go ahead and volunteer, but sadly the doctor will not even share this information with you. So then what happens? Some doctors are a little more conscientious. So they'll do a 1-year fellowship or a 2-year fellowship in some of these larger clinics. And these fellowships have been recognized by the Federation of Gynecological Societies of India or the Indian Society for Reproduction. But again, the same problem applies, that most of these fellows are just treated as glorified clowns. Their entire job seems to be to take histories, to talk to patients, perhaps to do ultrasound scans, and perhaps to assist the doctor when the main doctor is doing the IVF procedure. But those doctors will usually not allow these fellows or assistants to actually do the procedures themselves, because remember, these are private patients who are paying for the treatment, and private patients don't want to be used as guinea pigs. After a year or a year and a half, sometimes after the patient is under anesthesia, some of these fellows will be allowed to do a pickup on one set of ovarian follicles within one ovary, just to see whether they can do it or not. But honestly, trust me, the practical experience leaves a lot to be desired, but there's no quality control at all, and patients aren't able to differentiate between an experienced expert IVF doctor and someone who's just practicing or just trying, because once you're under anesthesia, you have no way of making out what's happening. What happens? Then some clinics will say, okay, fine, I don't understand this and I don't even want to train in all this stuff. So what do? They import the expert. And again, there are two ways of importing experts. You can import the IVF specialist, and this is usually a brand name famous doctor who will spend 1 day in Delhi and 1 day in Calcutta and 1 day in Jamuna and 1 day in Bangalore or wherever else, going from clinic to clinic to clinic, where he basically spends a few hours and does all the egg collections and then goes to the next clinic. Now, he does a lot of cases, but that's not necessarily in your best interest as a patient, because then what these doctors and these satellite IVF clinics end up doing is they end up batching patients together, which means this specialist doctor ends up doing 5 or 6 or 7 or 8 or 10 cases in one day, which is great for the doctor because it maximizes income. It doesn't make any sense for a doctor to fly down from Bombay to Kanpur just to do 2 or 3 cases. So it's better for the Kanpur doctor to batch lots of patients together, and it's better for the Bombay doctor as well. But it's not good for the Kanpur doctors, and it's not good for the Kanpur patients either. Not very good for the Kanpur doctors, because they don't learn how to do the IVF themselves, because the doctor from Bombay is so busy doing the procedures that he has no time to teach, and he's not interested in teaching, because if he teaches them, then they won't call him again. And not great for the Kanpur patient, because then the doctor who comes from Bombay has no idea about the history or the monitoring or what's happened, and he just comes and goes, and he actually is behaving not like an IVF expert. He is behaving just like a technician. You can imagine the results aren't going to be great. But then when the patients don't get pregnant, and typically in this batch of 10 patients, 8 don't get pregnant or 9 don't get pregnant, The Kanpur doctor blames the IVF doctor from Mumbai, and the doctor from Bombay blames the Kanpur doctor, and it's the poor patients who are the sufferers. So please don't let that happen. You should go to an IVF clinic where all the services are full time and provided under one roof, so that you know you're getting expert care and by experienced doctor who only have one focus, and their only job is to get you pregnant. And the same problem applies, for example, when they import an IVF embryologist who travels from one center to a second center to a third center, but doesn't have time to really do lots of procedures which are required, because he's so busy processing the eggs and the sperms and doing the ICSI for those 10 patients who had that collection and done in that day. And he can't spend too long in Kanpur, because guess what? He has to go to Lucknow, or he then has to go back to Jhansi or wherever else. So he only has 1 or 2 days to spend in these places. So he doesn't have enough time to do blastocyst transfers, doesn't have enough time to do freezing, as a result of which the quality of care of these patients keeps on suffering. And the biggest tragedy is these patients themselves don't even know how poor the quality of care they're getting, because these clinics typically will not provide embryo photos. There will be no transparency at all. They'll say, yeah, we transferred 4 grade A embryos, but whether they were really grade A or no, God only knows, because there's no photographs taken, no documentation. And the reason is because they're not really very good at what they're doing. And a lot of times they will take shortcuts by putting 4 embryos or 5 embryos back, which will obviously increase the chance of getting pregnant, especially for young women who ironically didn't even need IVF in the first place. But because they're batching all these patients, they keep on selling IVF to them. They say, hey, there's this big shot doctor coming from Mumbai, and we already have 10 IVF patients cycled up, so why don't you also do the IVF? And the poor patient doesn't know any better, and the poor patient trusts the doctor, so therefore they increase the number of cycles. And obviously if you do IVF for patients who don't need IVF because they're young, the success rate is going to go up. And what's even worse is because they put so many embryos back, the multiple pregnancy rate actually increases. Now, doctors are very proud about the fact that they ended up with so many pregnancies. But remember, the outcome for twin pregnancies and triplet pregnancies is not good, especially as compared to singleton pregnancies, because a lot of these pregnancies will end up with premature births, and these poor patients will be stuck at bed rest, or the babies will be born, will end up in the ICU and end up with cerebral palsy and other problems of prematurity. So the message is, you need to look after your best interests. One way to start is called information therapy. And the right way to get that information is on our website, which is www.drmalpani.com. We've got over 100 videos. We've got thousands of pages of information, which I can vouch for because I have written it. Simple, crystal clear, easy to understand. If you have more questions, we offer a free second opinion by email on our website. Look forward to seeing you there. We look forward to helping you to have a baby.